So I get this question a lot. How young is too young for a breast reduction? So as a surgeon, there's a few things that I look for when talking to families when they bring their teenagers in to discuss breast reduction. So the first thing is how far out are they from their first period, and are their breasts still growing? So they've looked at this in studies, and if you are 2 to 3 years out from your first period, you should be relatively stable with your size, and it can be a good time to have surgery. The other thing to look at, though, is are you still growing? Even if you're a couple years out from the first period, if your breasts are still growing, or if your child's breasts are still growing, it's probably not the best time to do surgery. Another thing to consider is size. So someone that is an F cup is very different than someone who is, say, an M cup, like a teenager that I took care of a couple months ago who had what's called gigantomastia, juvenile gigantomastia. So we sometimes will intervene early when the criteria aren't met for breast size becoming stable. When the child's breast size is so enormous, it's really impeding their ability to function and wear clothing. And then the final thing is when I'm talking to patients that are interested in breast reductions and are there with their families, I want to make sure that the young woman really understands what we're doing and has a good understanding of what the implications are long term, like not being able to breastfeed. I do think that it's really important that they are on board. They seem to really understand the risks of the surgery, and they're ready to move forward. This is obviously a very complicated decision. These young people can be very tormented psychologically. They can be harmed physically and can have a lot of pain in their neck and their back. So we want to make the right decision at the right time, and there's no perfect algorithm for every patient. It's a really individual thing.